Hello, hello, hello. This is Jenny Cantor, performer and physical therapist. I'm the founder of Powerful Performer, which is an online course for performing artists on health that helps elongate their careers. I want to talk today about possible muscles that could be contributing to your knee pain. Possible muscles that could be contributing to your knee pain. What's up, Morgan? All right, so knee pain. Let's go above the knee first, okay? Your thigh, specifically your lateral quadriceps, called the vastus lateralis. That commonly can get very tight and it becomes more dominant than your medial quadriceps, okay? So the muscles on the inside of your thigh, as well as the adductors, the inside of your leg, like right in the which I'm rubbing and you can't see, but that's not really helpful. But the inside of your thigh, the adductors. So this is the adductor magnus, adductor longus, adductor brevis, the gracilis. All these muscles that adduct, they could actually be very weak and not being used so properly as well. So weakness on the inside and overuse on the outside. I'm doing big picture. This does not apply to every single body. Okay. If you really want to get individualized, of course, go to physical therapist. Okay. Back to what I was saying. So when you take a roller, if you're a performer who's taken a roller and you've taken that like rolling pin on your leg or even the foam roller on the outside of your leg, it's because what I found is happening is your vastus lateralis, your lateral quadriceps, is not, the muscles aren't sliding and gliding. It's also sticking to your iliotibial band, which is not a muscle. So rolling out the iliotibial band like that, straight outside of your leg, as much as you feel like, oh my God, it's like really hitting, you're not really going to get anywhere. You actually need to move more up towards the top of your leg or down towards the back of your leg to get the muscle moving that's sticking to the band. That's the problem. Okay. So that's so we've talked about the quads, we've talked about the inside of your legs. What could also be contributing to your knee pain could have to do with tight hamstrings or weak hamstrings. It depends which. So with the it depends what's going on the front of your leg, how that could be affecting. So you can see already, I'm pretty much just going through all the muscles because it could be all these muscles. They're attaching down, they cross the knee joint or just above the knee joint. So you have to include them all in your thought process of what could be causing your knee pain. Then, hey, Christy, hey, John. Now, if we're going to talk about knee pain for the bottom of your leg, actually, I'm going to go to the back of your calf. The back of your calf, there's many muscles back here. I would count so many of them. There's one that's called the popliteus. It's, oh my gosh, this is going to be hysterical. Here we go. The back of my leg. The popliteus is like a strip here in the back of your leg. And what it helps is unlocking and locking your knee when you're bending and flexing. It actually is kind of that slight rotation in your knee. It's part of that, okay, equation. That could get overworked or tight from whatever injury may have been caused. If you have some sort of meniscus tear, if you have any type of malalignment of your bones, it could be tight and contributing to the problem. Your gastrocnemius, your soleus, your plantaris, which is a smaller muscle that starts up here and then the muscle belly is really up here, but then it goes down here to attaching to the same spot. This is so ghetto of me. I love it. To your calcaneus along with your gastrocnemius and soleus, and it helps assist the gastrocnemius with the knee flexion and the ankle plantar flexion pointing your feet. I know, I'm going so fast, but these are, I just want you to emphasize. Then we have the soleus. We have the muscle that points your big toe, your flexor, like this, your flexor hallucis longus, your tibialis posterior. That's a big one that really points your feet, points, and it also sickles your foot. Points and sickles your foot. Because of where it attaches, it's up by the knee. It could get affected. All these muscles here could just start going shh. And also your flexor digitorum, which attaches to the the lateral toes, not the big toe, the lateral four toes. Oh my gosh, this is so funny right now. Yeah, clearly I need a model, but this is the big toe. So attached to these toes in the back, and it has them do this. Okay. So those muscles there could also, that muscle starts up and the back of the leg and goes down, that can also be tight. So there's so much to consider, so much to consider. Oh my gosh. And that's just talking about muscles. If we're going to start going into the joints, into your joints, oh my gosh, there's so much that could be going on there with your bones not moving along, but that's a whole other discussion. So this is I am sure, honestly, other muscles are popping in my head. That could be up at your hip, that could be tight. Your muscles at your hip, the front of your hip could be tight, and that could be contributing to your knee pain. So this is what you need to think of. If the muscles are working in a way that's not together, in which where let me rewind. The hip joint is supposed to move, the ankle joint is supposed to move, the knee joint is supposed to actually be a more stabilizing joint. If the muscles are working together in a way that's getting the knee to have to move more because we're not getting the required movement we need in the hip or the ankle, you're going to have knee pain. Okay, big picture. All right, clearly I could go on for this forever, but I think this was good for today. If you have any questions about your specific knee issue, feel free to reach out. You can write in the comments below, or if you want more privacy, of course, private message me. I'm here for you. That is it. Take care. So long. Farewell. I bid you not to